Ghana mapa, an African no one to Ghana idea. Wonderful, no make for massive products. Amount. Never to Oko African shop here remove. Never be here. But when they not show massive for product, only be no yellow, ebony and go. Where Zoe and Casa would deal with the season, no and Casa. Sounds so any more almost big to mix. Any bread, Okaya, no do make more, and that's what don't quite and was so would be. Sounds so any more upper prancer mix. I have ready. Sounds so any more Tom Brown, Oka, no would be. Oh, baby, so for go massive for ya, a house cocoa. Are you ready? Sansuna, oh, I am ready. Okay, I now don't quite be out so. Now, now, said people talk mass products and also pan. Oh, cry, oh, no, Sapa, oh, Agusi, oh, Dakwa, it's the part of African shop, PMA. The part of the also confess, a mass products. Go, no, so show Gianna, Neddy, Nene Apomodimpa, Nene, the only Apomodimpa, not just a woody here, Apomodimpa, and a here, a dear, a Jumapa. The part of mass product, oh, no, so be. Not so, not for you with Gianity, no water with some pa, where dear Gianipa, or about the damages. Mass product, or which be a no baby at home, and all baby, the big fear, or we ye, Nakasia, or we in Kitua, who baby number 2 not one, the battle, free near baby, over 973 609 3741. Now, a friend, no way to now swap out home. The battle organ said, yeah, any commands, a boo or homo, the battle may be, oh, somewhat, Accra, Ghana, baby Biara, I'll be brown Ghana, so mono, be. Our honor, mass products here, every Ghana, and would say, packaging and see it's all about mass products. Ebusion for yema obi biara akwa abasronko e de ba obapatio TV so na munim no this month health awareness month emu ene ye wo no eno nti obapatio TV for yes ye ntena se ebra ye ntimi nka apomudin ho asem bia eni nti ena ye nuanom bi apebre so omuni ye eba beche apomudin ho ensem na ye topic ba ko a super medime di se sa topic yi ye topic bi a ehunyi ankrofo ye onpese ye ka ho nsem efse nyama bebre ho no mu a eya na eba ye ngana fo mu a ye din se ye be accept se be ye be accept na ye husi na ye no afa no eya na aye din enti na ye nya ye nuanu mi ti we de ye nsa bre obapatio TV ye di ye time so pa ka se be sha yeah, 6 o'clock. Yeah, I shall say 6 pepe autism and home. Inti yanko mo akwa basronko embra oba papatio TV so ni ene omo en start entwetwe nkomo. Me start e free me nua be ma Frederick onomo. Frederick me ma akwa basronko. Me ma wo bodin ni udibie se ne be ya dodo na e show no omo nso be hu adwuma wudie na omo betie wo nso e wo asopem.
Yo, me about me that say or mammy kwenya way. Me din the Frederick Omani. Na me a board certified behavior analyst. And I'm a licensed applied behavior analyst. Na as I say, no me DBA no me a clinical director or a human service organization via Massachusetts. I as a licensed behavior analyst for the past 7 years. The evidence many kwenya way say member of program is na yembe ending komo kakra and for autism.
Medasi bebre yenko ye sister Benis well eba ye sister Benis there eba apomudin a eye gusta han mu say de ye nimne pipe say no atwetwe enkomo e wo studio krada enti no eya me de say abrena brenyan so ye to ye nsa frena on say brekra on pupu ni tin so no ti be kan ye ho e be kire ye ensemu Benis we de ebia na ene de dikan a obi ehwe wa mema wanka so say introduce ho akire oba patie ahwefo a mo hwe wene.
Yo, Mpacho, Miss Yefremi Bernice Ankuma, may a licensed independent clinical social worker. Mene different population ana ye juma mene mofra aye juma ache mene sebio impanyinfoɔ a ɔmapom like ɔmo terminal condition so ɛyɛ adwuma meyɛ mesan yɛ adwuma with nkurɔfoɔ a ɔmayɛ addicted to substances, alcohol, drugs, ɛne nea ɛkeka ho ɔmowɔ in general ɔmowɔ problems with addiction. Many families nso ɛyɛ adwuma. Nti no baabiara a little bit piece of it baabiara mewɔ hɔ. Meyɛ adwuma nso in different settings. Sɛ in home, like going to semi konkofo fie mu, anaasɛ mewɔ clinic yɛyɛ adwuma, anaasɛ treatment centers, and also those settings nyinaa meyɛ adwuma. Yɛka how many years we are talking about is either close to 10 years or more than 10 years experience working in as a social worker.
Oh, thank you so much.
That's
Ansa
it.
na
So,
mekɔ yɛ nua bɛma ɛyɛ Frank ɛwɔ no no. Mami hwɛfo mo hwɛ so si me hu ɛyɛ Albert Apia ɛwɔ so. I say thank you for thank for all you do for mankind. Hena yes sister Eunice nso aba so tena enso me hu mo ba so a wokasa na atro bibia ye bema akwa aba enso aba so. Ne na ebedi jawa questions na enim nko ame ho utso de ba ye nuanom yi ebe answer question no ama wo pepepepepepepe Frank so de ye ne na eson enso e wo ba asenti ba apomuden ho na meka ompupu ni ti kra oye be me bia apomuden ho ya ne panti no so onya ka de ane obe mobilize ne nkrofo sesi asem mesen na ye hyehyɛ ye ne enkoka apomuden ho nsem Frank mema wo so wa kyerɛ bibie na adofo enso so ate.
Yo, mini about me that was it. Pacho me so yefra me Frank Techi Apea. Me a master's level and licensed mental health counselor. I've been in this field in different areas for I would say it's 10 years now. But currently I'm a clinical supervisor. Ɛwɔ adwuma me yɛ sɛsi ɛwɔ Massachusetts me so population that I've worked with me ne nkora yɛ adwuma many adolescents and many mpanyinfoɔ ayɛ adwuma when it comes to diagnosis and access special way so I've done it all so that's it for akonya yi sɛ mental health month and so when my yasa akonya si mbra ne adofo mbɛhyɛ one or two nneɛma bi ne yɛn answer more questions bi ɔmo.
Okay. Me da wasi bebre. Sister Anita me hu wo na mame na ya me hu ososo e wo so. Ya da mu nyina say o say hi my brother Frederick. I see you na I say unwe bi apaso bra Frederick. Yen so na ene enkomo no emi say ebe do so adofo no so de om questions beba. Enti no emi say yes ladies first. Enti mame nko me sister ho first na me nko say sister Benis ene your topic no e men autism spectrum disorder. Say you can say autism, a mepacho, ya tia. Enene edian ya re mepacho betimi e de brofon so afrem if say me gidi say adofo no mehwe enyo nyina so na titwi. Enti no betimi de brofon enso afrem mama mi.
yo, me da say, a good so say, yeah, the bro for ne fra because where's Nibi wa high na me ni say me ni treating. See, I autism. My main start. I know say your previous broadcast. Yeah. We talked about mental health in general. Say most of them are behavioral. Now autism, no, acquire neurological condition. See, a kind neurological condition na it will brain mo. Ana eshasie
Okay.
efree. Nti no, ɛhyɛ ase a affect areas. Major, yɛka three major areas are affected. One, air communication. Say nipa no any obi bedi inkita ho. Two, social interaction. And also akoye sebio yaka social interaction. I know say communication is part of it, but even say ayonkofa and as personal relationship with other people. And another one also your cognition. Yaka cognition me nua mema mo be boa me kakra wo twi no mo. I don't want to use the word nimdeɛ, but
Ntiaseɛ.
ntiaseɛ a wode bɛyɛ adeɛ. Aha, me da se. Ntiaseɛ a wode bɛyɛ adeɛ, wode bɛ solve problem solving skills. Ni nyinaa ɛka cognition ho. Nti these are the three major areas autism affect communication, interaction, social interaction, and then cognition. It's ana sana mekain so every adwene mu na se yehwe a ne hyase no start bri mmɔfra bere mu sɛ abɔfra sɛ bi ondi 2 years krampo no na ahyɛ aseɛ dedaada ebi wɔ ha ɛhyɛ aseɛ firi yɛfunu mu ebi wɔ ha ɛhyɛ aseɛ firi awoɔ ɛno nso yɛbɛkyerɛkyerɛ ne nyinaa ase ebi wɔ hɔ nso a ebi nso wɔ ha nso a panyin nso tumi nya autism sɛ bio yɛn a especially yɛn a yɛfiri
Na
Ghana
kese wanyini
dedaada no
awie no.
when you know the signs might be there but we are nkwalaa no but yenhu ne yie but when you no wobɛhu sɛ ɛɛdaadi saa na autism ne teɛ obi bɛtumi awɔ ba na mebe na ɔkasa o ɛnso ne kasa na ayera ɛni hɔ biom eti emra na ɔkasa no wo a woyɛ ɔwofoɔ no you don't see it because you know say this child is growing like the child is having a normal growth eti ekyire no na wahu na wobɛhu sɛ sɛ yɛka doctor's appointment sɛ wowɔ akwalaa at the beginning no yɛwɔ frequent appointment na yɛbusa questions ne nyinaa doctors no anaasɛ akwadaa no pediatrician no or check it for signs and symptoms yɛfrɛ biribi milestone a ɛkyerɛ sɛ akwalaa no ɔnyi a ɔduru 1 month a ɛwɔ sɛ ɔtumi kase anaasɛ ɛwɔ sɛ ɔtumi ɛyɛ noise a ɔmo yɛyɛ nkwalaa esu ɔmo noise ɔmo reaction when they see people familiar people when they see strangers saa nneɛma wei mu nyinaa no pediatrician no sɛ woyɛ ɔwofoɔ ne sɛ wobɛkae a yɛma list a wode check ne nyinaa eti akwalaa di 1 month a yɛwɔ ne milestone a ɛwɔ sɛ ɔmeeti oduru 6 months a ɔwɔ ne milestone a ɛwɔ sɛ ɔmeeti oduru 2 years a ɛwɔ ne milestone a ɛwɔ sɛ ɔmeeti yɛmfa ne sɛ ɛyɛ speech krampa a ɛwɔ sɛ ɔtumi kasa 1 2 3 4 5 6 anaasɛ ne nyinaa wɔ ne milestone nti autism no sɛ akwalaa no ɔmmɛse 1 milestone koraa mpo a etimi yɛ den etimi kyerɛ sɛ ɛyɛ sign ɛnyɛ sɛ all the time na ɛyɛ autism miss
Okay.
ɛyɛ sign ɛkyerɛ sɛ yes autism ebetimi akwalaa no betimi anya autism.
Okay. Mamembra yenua Frederick so. Yesterday ni saka bebre. Edi empiem na ye signs obetimi die hu se akwala afe na ena nkwala ne hu ya me pa. Odi mpanifo de ba ko abere mu de but nkwala ne hu ya because on start free. Say ye hu ni mfiti ase na ha adwen tina say ye die nyina Ghana fo so and Africa fo ne atemi ni bibi foforo kra. Enti die signs biem na akwara ebede edi ama wonhu se ewo se uma weni kohu se betimi aye bia
Yo medasi ni nuaba sene ye nuaba ni di kan ye no mefra se afi ho sene all kan say ye neurological and bio neurological condition no ade a affect nervous system no nti ye kan ye fa adwen no or spinal cord and our peripheral nerves nti no send ye names in the nervous system near Etienne. I had to say, yeah, the two be want to say, lighter in a UCR. Say, be teach ma. Bibia light na say could drew entimi ndru na generate power na ma wahu mfa sa homa na ti o ba bia o de bulb no be hye but power ni ntimi ndru ho na eden aso no say me can literally sa na bia ye benya nti ase kakra international say yemfa ye ni hu sa ni man ni timi ti chima ewo akwala no say e free ye funu ana say ye wo no wie no bibia ni o man say ekokodru na ndru ho nti na ma wanya deficit ewo enyuma bi to say kasa se ne nua ba ne kan ye no no ka communication nti no nkwala ni bi kasa delay nti ne kasa kra no on kasa ntem e bia 5 years 6 years ne kasa no embaye se e bampo kra onye spontaneous or ye kind of or scripted bibia ndi so prompt na answer na waka na on to mean string words together say bia a comedy me ana ma nsuo no gise waka hye no naka sana empalani be a present ntino ye ba signs and symptoms no ye nua ba na kan bebre into language dia na maka sisia no omusan wo ayi bi o characteristics bi o mo eye bibi de say ye fa social communication no mostly no omuntimi ene afoforo enni nkuta ho ana nkomo ntino se nkwala nyina hia no so mu di agrokra na se ono wate no ho why odd bi omumu ontimi interact ni dia nse ne oye no ana oye den oye ye frɛ bibi so joint attention se bia si aye nyina ya adwen akoso no oni de wonte da onim ne akokra ntino se bia ka abo aben na obi achi na ni akohwe ho na bibi si na obi adwen akoso a ni oye no na adwen fi so ni oye na no because why ni oye na on pay attention to whatever is happening around him or her in the environment. Ade ba ko no say oboni din a ote se waboni din but on yi on orienting no towards nipa na o friend no mfa so wo na chi no wa friend na o ntwe na ni but wate so what in chem na o friend na on orienting the board and usually no neurotypical people so bi boy din a ya njisu kura betwa ani ahwe nipa but omo no it doesn't come naturally omo no inflows omusan wo bibi or mo from stereotyping. It could be vocal or motor. You can't vocal stereotyping na omo repeating your bi omo as assembly na beba na numa obe repeat asem ni sa no na okan na num sa ana say you can't motor stereotyping so a movement e bia a hand flap obe nante won nan ano na obo hu say of or ye nsane sing omutimi make excuse me to say weird noises be a repetitive nta no mun nyina ka science no for nkwala nketo ade sisia no research am hu say nkwala nketo akora za akwala afra ya wo mbese 1 month ekono omutimi detect say akwala na frase e meet ne milestones apart from the growth na say bia wo ti say enu abanje di kan ye no benefit di kan so otimi track it nza akwala nya bese 1 month na say wo begina nanim ana oda ho na nani beto anim na wo move na ontimi track wa na ontimi follow wa na say you should be concerned about it na say odi kan about doctor's appointment no during those appointments no say we discuss sa anuma nyina with the pediatrician because onu de onim say wo na wo hu sa anuma we na most of the time e ma checklist say wo make sure say akwala ni anasa abofra na wa wo no achieve sa milestones no Tina enyoma ni bi no ye kwa enim na think say questions ni bi ba e bi
questions no me hu say bi start be ba nti ne se na ye ka ye kwa enim no momie ndru be bi ansa na questions no ya answer bi ye mra ye nwa be ma Frank wo na embusa say me de science no to be honest me if you said ye na ebe kan nyina be dum djuma kra enti Frank se bia wonim sign bi nso so a unua no mo embo so a na pese wo bo so ampa cho kwan da wo ma
Sorry. May that say for a question, no? Yeah. So one or two be a may add it to minya ba ni minya bema emboss yeah. You know, we talk about obsession. Minya bema Frederick Eka about the repetition of words, maybe a word back or be kasa. And there's also this obsession for particular item be. And I say be or the diagram. And most of the time, no, say at the chrono, they will see the diagram. You see a pattern the same way. What tries to be changing that pattern now or no be way issue on out, and you may not understand. So you see kind of that repetition in the way they also play. Say oh diagram, the beer, say car, and as a Legos no arrange or arranging in a particular order. And you see that all the time. And also say another thing is so you see, say you see them like rocking the chair, no, like in a particular way. That's how they do it. And it differs from also one child to another. So one way another kid will do it, you don't expect another kid who is also diagnosed to do it the same way. Because here there are different individual differences here. It say akora baako ono de ne repetition no and I say the wo si di na agro no say a teddy bear bi no didi agro de bi o hye ne corner. You don't expect say also ba ube hu say ono so the teddy bear and the corner. E bi on the toy cars. And also at the year night. So these are some and as a one or two be a meso me de candy nia ba ni nia bema akano.
With the seminar by and have the Kakrabe can who ha, if that's
What of I can man?
ha. Near Minia Beman can and cre na near tear was a who say, very regimented. They are very set in their ways. Internet so used to Bernice. Say Bernice na money be an Adriania. Say Bernice a money now owned. It me a bit me a sister. So all can toy back obit me the diagram. Toy net to take now replace or on tiasie. Say ni schedule change biba. Say be a senka be because now nkoswa. They struggle a lot. They have a lot of behavioral issues around that, like tantrums. Where the nyakwala who was suku to a be jai. Obi super ma ohwe down. Now in the process of doing that, no to me if a ham or mom to me proud obi to me abono power to me say oh but on to me jai. To me say nyoma and so. Now I about nyoma some of the signs now so I feel say bo ma didi mu a say pizza ba pizza na de bia obedi. Also the no from na ondi akombeden. Say nsuo na onom and I say juice bi na onom. Fancy orange juice and I say even apple juice ni say taste ni saketo bia onom. Or you're so used to that taste. I don't know nim we will find bibia bioma it will not work. And some of the things that say we a parent and I say kuta kwala and say sa we phrase so who say science na say who say possibly no bit me was disorder and next uma a diagnosing. Now with diagnosing, I think say well nipa or more side diagnosing, but if it gets to that point, I bet we can talk about it.
Okay. Well, waka bebre pa maka science ni na na me dese maka do but questions na ba na ebi so frafra me questions na ya set no enti mami mbusa yaka science no ye musa say ya woma ye didi ye ana say edi me pato mo chirechire mu kakra your best start bia ma bia.
All right.
Maybe start. Okay. Na me per se esan say ma me start free pregnancy hot side no. Risk factors. Number 1, and I say and just no na edi mu akoten pa ba ade a etimi ekose say oba unyinsen ebia onyem na ono monsa. And I say ofa edrubone like any illicit drugs nim say yen be before the meaning say yen sheda a teacher name man meaning say yen sheda and fa edrubone ne sa enema na ebia cocaine opioids ebia sometimes crampo no mesra say so bia nyem ne say o take antidepressant you want to check that with your doctor and yet any prescribed medication bia and was a wofa ebia even with anxiety medication wofa antidepressant ni nyinaa mesrɛ wo ne wo OBGYN money all the list of medication ana sɛbio yɛ bibifo nso yɛnim sɛ yɛfa bibiduro nso ebia ɔbaa nyinsɛn ɔfa bibiduro mesrɛ wo discuss ne nyinaa with your doctor. Say draw way any a draw way na mefa ebia ebibiduro no obechecki ingredients na omde ye no. Na watch it because what the doctor bibiduro ofa oni medin no. But so timi nya ingredients a omde ye sa eduro no. Wo de kyerɛ o primary care na anaasɛ wo OBGYN na obetimi akyerɛ sɛ we de enye even in some studies no normal Tylenol koraa mpo no etimi ɛkɔse saa adeɛ no ɛwɔ nyinsɛn mu nti ɛno nso no wobɛ yes ɛno nso no adeɛ bi a wofa bia mesrɛ wo wo ne wo OBGYN ɛndi saa nkɔmmɔ no sɛ ɛyɛ ma wo adeɛ baako nso a yɛhu nso yɛ gestational diabetes sɛ ɛno nso etimi cause that obi wɔ ha ɔni diabetes but onya fra yɛfunu no a wobɛhu sɛ no wanya diabetes ne nyinsɛn mu sana yɛdi kan ɛnyɛ sɛ wonya diabetes a kyenkyen aba benya autism but these are some of the risk factors a etimi yɛ den ɛkɔse saa ana lack of certain nutrients in us eti no sɛ wonyinsɛn so a wobɛdi balanced diet ɛno na yɛhwɛ a wobɛhu ama yɛn prenatal vitamins na wafa folic acid ne nyinaa ɛboa with akwadaa no a ɔhyɛ yɛfunu mu no ɛboa ma ne brain no ɛyɛ den ɛdevelop yie ana yɛasan yɛ nhwehwɛmu nso ɛho sɛ even German measles some yareɛ bi a etimi yɛ mmɔfra a kyɛ sɛ wonyam so etimi yɛ wo no ɛno nso timi cause saa meaning sɛ yɛn mu bebree yɛ ebi we don't like the vaccines but then we have to take it because wonyam ne sɛ saa yareɛ bi kyew a etimi affect akwadaa no a ɔyɛ den ɔhyɛ yɛfunu no mu no eti no saa nneɛma wei mu nyinaa na ɛwɔ sɛ yɛhwɛ na yɛ discuss saa nneɛma ɛkɔ so nyinaa sɛbio wonyam you are depressed wonyam wofa titiw bi mu wonyam wofa ɔhaw bi mu whatever that you are going through no can affect the child in the belly wahu eti yɛnhwɛ yɛn ho so yie yɛn nyinsɛn mu no na biribiara yɛne yɛ doctors ɛnyɛ den ɛnkasa ɛhwɛ
Yosta Benny said, better was a bebre. Essence, and I share a tear for any phone in our boss say, and your more and a bedi to mediano. And Mr. Questions nearby, you better take a real musene bear. Ye miss you be a question, be a womb. No, see, sister Tina, El Shayan, all the way from Virginia. PKY Nana, or no so, and no questions no more, dear Pano, no so the papa. Question we say, Yen Shena, Yen, she bit me answer. Any advice for parents who have children with severe autism because research shows that Africans struggle to come out for help?
All right.
Ebi wo hokra no ka se odilebo ne be no nyama bi se ntikra ne de akola ne isie ne de ne tetene na sefo nti na advice bi wo ho no mu a awufuo bi wo akola bi a ne autism na bi a ebi ano odi nchen bi eno ye me question am wo a mebusa mo but yan answer your sister PKY question man ne pa cho se Frederick Befen no
yeah near ten say near the question will be say no krepa na eno no eboa ma yete ase se autism no enye sebe honhom yare ana eniwo yare bi ana sebe obonsam yare bi neurological conditions ne edika me nua ba ne dika chechire mu pepepe enti no se eba ne sa na ye what treatment wo ho any cure, but you treatment say akwala ni nya ne ntem a eboa ema nneoma na wontimi nya ni nyina over time na wotimi eden eye ema wotimi be live normal life. Entino wo de ni si a ebe ma mre bebre atwam saa mre na se nko nya saa moa no formative stages no na saa moa no tete ne nkyerɛkyerɛ no betimi aboa na ma na pick up nneoma na onim na say or deficient in no. So wo twɛn ma mre no twɛm bebre na fe wo seek support and as intervention a jimre. In some fans who could ankwala mienu omu nyina ya diagnose omu for autism. Na say at 18 months back we started early intervention. Maybe I would later 5 years or no by the time 5 years no be catch up na when crown more or less no or function this normal just a neurotypical person. Into going back to send your name some of the things and say there's not enough literature on some of the causes, but a new man business say unfie kwanim bebre so ne say ubenyinsen there are chances that ubetimi awo akwala or autistic and autism. Nti na no so ya dia o ana say wawo akwala autism. Likely say bia na chinkwala no ebi so betimi abaye autistic. And these are some of the things I say I will for as parents ni bi ehun. And winya uma ye diagnose no say yes or autism and or autistic pe and that was seek early intervention. Early diagnosing, early intervention over time they become pretty much normal. And so be autism one now interest won't mean leading normal life. Just say or no ninuma be na catch it, but through intervention or betting catch up. Maybe mutimi school university live independent life. Again, that brings me to autism. Beginning now your friend autism spectrum disorder. Yeah, can say a spectrum, which means means a spectrum now.
What's me the bro for fra because and then confirm be a me one more so I'm teaching
yeah science kakra near the day say yeah the man say your stages and now say levels of severity and you know obi dia betima very severe, which means be a one kasa just on tin you might be say and also developmentally delayed and you might be if you could do affecting the non-tier in motor skills, fine motor and gross motor. The gross motor is a be a bit near pagan inside to ride a bicycle, will be a unique sa ways in coordination. Will be also I want to mean so pen, mukrampon or the atra, the international if you want to modify pen or not grip and I can see as maybe a bit so much. And no a year and during intervention, you'll be a friend multi on us interdisciplinary approach. Nipa bebre involved in providing care and our services. It be a speech therapist, it be a occupational therapist, it be behavior analyst, but a usual like counselors, almost they have a role. And a drew say yeah, providing the service as a whole, and nipa bebre and come together. Now all my providers are or follow somewhere in the spectrum where very higher functioning, you wouldn't even know. Me start here, you 16-year-old you are na me koni fie. When you nane tintin krabe and me bepe woman who me physically. I was even intimidated by that boy. But the thing is, I kept asking myself the question, say, identical and me bafia because this kid's normal. What to me is you know, or co-school or high school or after school programs or take it driving lessons at age 16 when you're on a driver's license. But then it traits be on who say or lack social skills or lack empathy. And that was the reason why I was there to provide him support. And you know, Obi beti my very higher function. Obi so Obi here a lot of support for the rest of their lives as a own means function without somebody supporting them. Obi so Obi my independent own here will be
okay. And the mama for you okay no Frank yen nua ba more didie you be answer mo say if a child is diagnosed with autism, does it resolve at some point?
Me that say, say question we you didn't kind answer that but mesa repeat abia na yenya baba so and check. So said you didn't kind no. So obi a diagnosed with autism. Autism is a disorder, mental health disorder. It's not curable, but the truth is early diagnosis with early intervention will help the kid or the individual to live a better life. There are a lot of people we have on our caseload. Some of them are in the university. Some of them are fully working, right? But said yes, sister, PK na nadin can be saying, and I'm say parents need be yana ye ferry say ye be seeking help and as ye be back out. Akase bia me bay MCC na custom because said ye can ye tree language in one ton or yaria.
So that's true.
Ultimately, bantam now usiki services are then the interdisciplinary approach and where therapists, occupational therapists, others involved, ABA therapists, together. You'll be surprised at the kind of life the individual will live later on. And just also to add, to earlier question now, yes, said like parents in be fair, it's because of that reason in na say yet to your home because ye look it itself. Baby I'll feel honey and so ye fit ye name into near to your home say ain't being in the field no. Ye okay, say obeba out or best struggle. Now I ask for help. It's okay to call and how do you approach in the grandpa and then what here. What I say, what we into the question be a unimia to my papa to you. Obit my link here to you to assist you towards your friends and resources are available for you to help with your kid. Into nasa na me person can be actually match ye mukakra ni ye group ni what we do and other things.
Kakra nka ho a yenua ba bi abaso yenua gifty nso ye behavior analyst ntimi ni nyina kita baako osan cry say why nya PhD grant or doctor yenua gifty no you can no no respond to some of the no respond to question na yenua ba ndikan say obinya autism no it's na yedi kan won't mean cure but with the right treatment and as intervention nipa no etimi progress to the point say the skill deficit no will improve on that in say communication afubon say otimi kasa so obi o ni language kra no ye wo kwan ya fresh and ye fa so e de kire wo I know na ya na speech and language pathologists in beba mu no te bi o obe use a device bi more or less no device no na ne nti say bi o use iPad o bi a friend touch chart and I say local to go nti no say won't mean be na no nkasa no eno no na ono de be kasa nto hia bibia okọ app no mu na wa selecting your man na string a sentence together nti bia nso no pa or be select na catch or say I want water nti no ye wo nyoma sa ho for o ma bia o ntimi enkasa no afi nso ye expose o mu tunyo because they o mo dwen no and I say sometimes no cry no with autism no most likely be more comorbid diagnosis say bia enye autism no kwa bibi fufuro san ka ho say bia for the most part will be all ADHD ka ho attention deficit hyperactive disorder omo ntimi concentrate omo very hyper like very active na they we will get to all of that no near here and say we make sure
say ADHD HDPRCD.
ADHD. Attention Deficit Hyperactive Disorder.
My Frederick, I best say enu nko an ye hia ho nkyerɛkyerɛ because ebi won my man no go school no ma tete say yetimi de bitu bi so ebi an ewom na enim timpacho ne de emfa meka autism no sesi akwa mi hia no ho nkyerɛkyerɛ papa enti e be hye da die no so ho nkomo separately na sa asem na enu so hia pa
yeah into autism no obia present differently into na yes say spectrum no obia different into no say obi behavior certain ways in a frank d kan na and no say wo ba no be and I say the other child obia different on how they present and I say how the symptoms manifest themselves.
Okay. Mr. Benis, yen hwe no mu say no hwe question we mami. And one man hwe your mema your question ya come phone so. Africans are mostly in denial no kware ana say tina yen ti ase no Ghana the phone ne ka so bi e want say ni say nipa na bodam. Eni na ato ye tirimu a besi na ebia enye enokra na ye help bi a yen pese ye beka kra suspect akole ebi say no akole I think so wo behavior kakra ka chani mama wan dwan tokwa bi ani mama na obekọ enye papa pato maye enchirichire mu ade chere kakra wo man
Meka say no correct. First of all, me person question ba could be no be ebusaye no. One, some parents are ready to get to seek help. They are ready to bring their kids out for society to see them. Parents are ready to send their kids to church. And idea it see parents mostly who kwan yeah so yeah Africans na mo ye hu nkwala na how do we behave obi wa ha sebio ohu akole autism ohu se ne ba ne ba akole autism crampo di agra na wakotwe ne ba no eti
oka
yeah so
autism ne kura na ka ya akono kakra kura nka nye ya akwanya yarefo
oh
pese
yeah
the way
eti yeah so Africans no yeah yeah ma any condition ni bi no yeah so yeah ka ho eti ma te se na nkwala bebre etie na yeka denial na no dey no correct. Number one has got to do with our culture. One say yeah African kasa no your culture your share your history sana obroni your research the condition be crampo ba obroni person hwehwe ma hu say we na air causes our condition no. We yeah Africa for no yɛ laake saa mehu sɛ na meka saa adeɛ no si yɛbɛyɛ nhwehwɛmu biribiara yɛde akɔhyɛ yɛayɛ no spiritual wahu ɛyɛ bɔnsam mebɛyi koraa mede ne kɔɔ Ghana na obi maa ne nsuo bi nom yɛ na ɔbaayɛ na wayɛ se anaasɛ menim yi na obi bɛhaagee me ɔhaagee me na ɛmaa mebɛyɛ anya autism anaasɛ da biara no we attribute things to spiritual. Yes, it could be true. Yes, it could not be true, but we don't have the evidence. Smart here. Most of the times, no, we are in denial. And now say, at the end, so I'm saying when they say, "Hey, akola we are akola bone pa, yen condition yo, yeah, akola no." Said you wouldn't call ni pediatrician hon. What check? Yes. And the pediatrician in him so you okay. And you provide any resource. Emma wo as parents no. It's no ba. Akwala no o friend kura akwala we na so nti ase as na so nti asem. Then we blame the kids. Share where would the nakwa Ghana na nka ya gwa ne ma 1 2 3 and why okay. It's most of times no one yenti we don't know. We don't know about the condition. Two, your culture, our values, uh ka ho. Three, I know say and I won't say yes so no um your style of belief system no sabi say ye Christonia menka si didi enya but me say me use the right words e wo ho no mo ye
right
spiritual ebia empire kwa ana ebeye den ebeye Yɛnkae nso sɛ Nyankopɔn nso ama yɛn nyansa ne nimdeɛ. Nti sɛ nnipa nso no, Nyankopɔn ama yɛ saa ahoɔden no bi. Ɛno na yɛfrɛ no intervention no. Yɛn a yɛwɔ ha yi, ɛyɛ Nyankopɔn na ɛmaa yɛn nimdeɛ sɛ yɛnkɔ school. Yɛkɔɔ school nyinaa, Awurade na abɔ yɛn ho ban. Yɛsua adeɛ, but Awurade nso aboa yɛn ama yɛanya saa nimdeɛ no. Nti remember sɛ we as workers no, Awurade na aka yɛn ho. So we are praying, and then we are also doing the physical part at the same time. It's a denial. Yes, most of us are in big denial of the condition. We either blame the child, we blame Sebio Obonsam, and I say we blame Obi Unanebi, and I say Ubibi, and it causes our condition. It's I know I agree with you. Yes, we are in denial, and these are the factors that are causing it.
Wow. Frank, maybe also Ansan Makoye Nua Frederick. Yes, Sister Tina, or say, how can I find out if my child's case is genetic?
So, said ye, oh, come that's for question, no. So one thing is that there is no way ubet me at nefie no who say me be case a genetic and I say a parental lifestyle during pregnancy and I say baby. But the best way for you to do this is get your child screened. Say be cry o parent no fie and who near maybe said the year say well who suspicions be you don't lose nothing going to your child's pediatrician now say idea we said mehu back mehu miensa. I want my child to be screened for autism, and they will be able to do that. But said the year so and I say didn't capture that. And so one other thing is this particular disorder no ebetimi a pass it on say bia sabi say obi will be busua no mu a anase se papa anase maame no say that trait no yewo ebia science no meka te say on friend chromosomal factor bi a ebetimi aye trait a the family can carry on obo say ni nua ba bewo na akora ba ako bi maame bewo na obi nso obi se wa bewo so no betumi happen say ebi wo ho saa say bi a onim say onua ba ofa o se wa ebusua no onim say saa case no ba ko mienu wo ho na o suspicion bi a no betumi ama a direct and as I redirect it enya me be niema ba ko ya wo ye wadi mfie say but enya hwe mame nkonkɔhwɛ and I say let me go screen it out. So you can start it from during Oba appointment with the PCP and as a pediatrician. No? Just mention it and they'll be willing to assist you to get to the real way of the situation. No? Name say otna ho na 1-2 1 amount dia said the din kan ho e be ye din pa say ubehu se bibi e koso. And what do you even lose? Say me was suspicion say me ba e will be. What do I lose? Say me call me screening out. No need dia. What do I lose? And no moment you better off than say you wait till sakra no any later in life. Satan no na niema ka chire inti ebema dwuma na ayeden as compared to say uswa na wohu niema ba ko mienu bi na opese oye no nti na answer me de bema ye nuaba no eno no so obi foforo ka ho a.
Let me say Frederick meaning so be before for kanwa woni bia na ndies a question where I come question no na mama wa answer because e bi so feel say vaccinations na e cause so sa enti no we say eja ye de enti ase no bi of course me ma ye wo me bapa ne we me wo me bapa ne we vaccination bi wo ho no mu a etimi cause so sa na eja awofo ye kwa yeso so ye ya shan ye I say we de me person de be wo me ba
yo me da se near tier say me make sure say answer way TT as ne be ya obi anya confused. Vaccination and cause autism. Vaccinations and cause autism. There is no evidence, there's no research or literature a support to say claim when say a vaccine ama ebasa nti no say akwala na due for the vaccinations ni bibia na mane ngo ze kura de say ombe woni nyina ato aso na yedea matia mze manya ntia say omutimi space vaccinations no ma de bia obekọ na ebe wa akwala na be say 3 and 4 and 6 you can space them out in a month period and I'll be bisa as be ya akwala no so beton but say vaccines also your friend is saying autism in the enye no correct.
Okay.
May call back to stigma no any senior in Frank ni Bernice di kan church mu no hadwen asan say bibia ye finu ne senior ye gidie tie no tin bibia ye attribute to honhom mu ade but enye honhom mu yare asan say nye ya bibifo nkwa ne kan okay mfa say ka bibifo nkwa abukra na enye ye Ghana fo nkwa enye African Americans omo nhede ni amamre bia no anasa abo fita no a omo nso omo gisa ni omo ani ndi no ndo omo nso no ba ne sen na omo ma ezunya anya ayi ntina se yenyi honhom de ne ntwenchen na yen tu anamon a ebe boa kwala na yen gya yen fere ne aniwu a yen se ye beka ho asem because years back make am say 5 years ago na me adwuma ma agency bi na BCB na cover sa akwala no oni ho na ye ka chem say ene me nko na me nko na me supervision apparently me hwe din na ye Ghana ni ye hye bibia all right but then me drive could draw ye friend me for office or say ma mother na cancel me ntiase ne say ohun say me ye Ghana ni no say ni be hu ade bi ense me hu efa no. Oh, and these are some of the problems, you know. Me nwanwa kakra because ya ti bibia ase amwati ase explanation of the mind into asum. Right away me hu say o Ghana ni na wa hu say me Ghana ni me ba ni fi and by autistic nti no any enjam enam mampokra me twen ama ni regular you know
the me yare ba say me ho
nti no ye hu bom modern say ye tu ho anamo na back to testing no senior kind start free akwala no pediatrician any regular doctor or nchen if you wanna say ope say wo doubts bi na ye on na betimi aboa onto ne kasa on be make referral to nipa omo be testing no ne bibia say omo ye bia nti say test bia be most of the time na neurologist and as a neuropsychologist and as a neuropsychiatrist in the SR testing no now my de into wo pese wo komu further now who say bia bibi wo ho a bia aduro not necessarily say aduro betimi aboa but then genetic testing so omo ye ntano no mo hu omo ye genetic testing na your family bia me follow mo akwala ne start it was an year from the doctor to I think a developmental psychologist or a neurologist. If you want, refer back to another person, near the dear Palan Koye, into your sending one kit about fee, ama almost swaps be almost swapo, saliva and the idea, or almost I silly on the coin on their testing, much I say, be say this, no man. No, me pinpoint is papa no maame no ne de no 100% akwala ni kuta but ba papa ne famu na ndru 100 no let me just put it that way in a layman's this instead of abetiase into no it take both no efu we saying no na ma akwala no awie per years na ye nyina hwe no but we inherit traits bi ana say ne ye hwe senka ma ne de na aye ma no and that one side na nyama into is a defect no it is certainly I can comorbid but we don't want to get into that. Let's just focus on autism today and yeah.
And yes, Sister Bernice, question or the aban way there. Any day, Mama, we're reading what's the difference between autism to assume
I'll say, what is the difference between autism and Asperger's disorder? Question where go back. Question where go back to the Anaya Frederick Eka about autism being autism spectrum disorder. First, no, na ya wo mu nchichemu, na ya wo autism disorder, no one, na ya wo Asperger's, no one, na ya wo two other different ones. Na but then they saw the need to combine all these together. It's a autism na you were different types. Let's start here free Asperger's. No, first near friend is just Asperger's disorder. Sa more Asperger's no na so wa busaye sa wutie ye bra Frederica na oka ba kwala 16 years bia na ohwe na otimi ni bibia. Omo that condition no. Omo ye very like you have to get so close to them to see say when na air course Omo crown ponsono. Omo timi ye your friend no you use word be as gifted, right? Your old term and you use obey highly above average. I remember saying and say my laptop say na media ma chia me no obi anye. Sebi onipa minya no obroni akwala e that Asperger's ni bi. Very very skillful.
Wow.
How are Otimi Cracky fix a laptop no? Until now I'm so surprised. It's almost to me a range from that higher level to the normal range. I no ɛso no ɔmowɔ ebi a beebi kakra wɔ hɔ a ɔmo hia mmoa kakra wɔ hɔ ana ɔmo autism no ɛyɛ deɛ yɛka autism but and also folly about autism spectrum disorder ɔmo na yɛ a no ɔmowɔ most of the times ɔmowɔ delays in speech no any social interaction any cognition na yɛdi kan ɛkyerɛkyerɛ aseɛ no nti ɔmo no you see most of the times you see the delays no ɛwɔ obi a ɔwɔ autism but right now we yɛn separate ne biom yɛni ne nyinaa yɛfrɛ no autism spectrum disorder.
Okay. Anyway,
Yeah,
trying to
and
see.
yeah, just to add really quick, and I know most of the sort of all kind of obey me, I develop all the skill set that or function just like any neurotypical person, but then no more difficulty relating to others socially. And to know, send me can you know, nisa empathy ni sometimes neurotypical people no one. And I say bit me about say read social cues and say be only deliver no both for your own sometimes be more present. And in the way they think or thinking no yeah very rigid. And to know say the be saying I want to know susu and I'll go back to that kid and I make kind of one say I nami huni and but then or nya very explosive behavioral episode be it made me wonder because na so bibi na no person or yen brave and ne maame nso kyerɛ no sɛ saa bere ne sɛ ɔyɛ no nti ase anya adwuma and no he got really upset and he turned the whole house upside down and no ɛno no ma uhu sɛ oh sɛ ɛyɛ neurotypical person a nka obetumi awɔ restraint kakra but ɛba wɔn na yɛ na wɔn ntumi nhyɛ wɔn so wɔ saa kwan no so ɛmfa no ho sɛ the way ɔbɛ respond and ɔbɛ react no bɛ affect too because onim sɛ for the most part some of them no ebi no onim sɛ bɛ affect too nti ɔno no how he feels and listen or interpreting he acts based on that.
Remember my question. Okay, Patrick Kasa.
Now me per se the range of I know so busa just the Asperger's and then the autism no. But now me per se me de ba could be kanwa. I know so a lot of mothers see that and know yeah childhood this integrative disorder no. And no na ube who say akwala no onyi no from 1 year sa bepim 2 years. Ube say no started mama dada mommy, I'm hungry. Mommy, I want water. But if after the obe no, na wejai kasa. And also yeah, spectrum and also yeah, one of the spectrum autism spectrum disorders no. Ubon say from 0 to 2 no, the milestone yeah pepe Yebusa question be oh yes, me by otimi say, otimi say, otimi say. But a bedroom baby no bon say na e decline. Why sa no otimi kenyina? The one no ne nkwala di agro nyina, obon sa fe de no start isolating ne ho. And also e wo ho no mo. And also no I know so won't be sad this question. But then research aba and also who says so do back the pediatrician adia back or more better ne say TV nkwala no ehwe. I know some ye babies ye YouTube no ye wo programs bebre gu ho no mo. Che say omo hwe. Na dia research ehu ne say ụmụ akwala ne start hwɛ ɔyɛ akwala no wobɛhu sɛ ɛtɛtɛni ɔmo especially yɛn a yɛtumi ɛyɛ adwuma wɔ fie kakra wobɛsi wo ho a na ɔhwɛ ne TV na wo nso woyɛ deɛ
and the
wobɛyɛ
why and the
yes mɛka sɛ ɛnyɛ that is a straight answer deɛ teɛ ne sɛ afei deɛ akwala no ɔno ne wiase no a ɔnyi aba no ohu sɛ mene ade kasa TV kasa kyerɛ me but I don't talk back. Nti akwala ne isua not to talk back to people because so they be a TV na ene kasa. Ono so ne nkasa. Eti no eno one major recent researcher aba che say e cause autism e won kwala losing their speech. And another thing also yeah say parents and also falling under that say akwala ne start say or kasa let's provide feedback let's interact with the kids oh mommy what do you want like busan me man nka mama sa no why you busy na say bio oh bon komo and I say ujina or phone so if you don't respond back sana akwala ni besua oh okay if I talk I don't get any say ABA fun but I don't get any reinforcement right so what's the point talking it was an akolan or lose motivation to talk it's and also and also yes childhood disintegrative disorder and say another spectrum a falling under autism spectrum disorder no and also as parents you for those signs and also the moment akwala started say oh losing his speech you want to like hey what is start seeking services and as I'll report makwalane pediatrician so maybe no losing his speech and as any social interaction most of the times or isolate it and also turn who free nipa ho it's Mr. Mo yenhwe and also
Sister Bernice, mesla ba homa menko yenua be ma Frank okasa ya che. Frank, at what point and was say you start ma ye ni breni seeking help because Ghana and Africa for say na yenua kan no so me kokra me ko share wan bi o ana say ya ye ebisai. Oh obekasa me kura me baby kura onya be yes sansa na o kasa na ya kasa atu ni tirim nti no nim se o enkola ni bi wo no mo ayesi o we ansa na o makasa nti eye den ya obekasa nti no seek help dia na nchen na edie na obeka kire yen ya wofo na ya na yeta wa adwene bi saa no ene omo so omo tetu fo saa.
Yeah, like I say, each one for himself, God for us all. Sɛ wode w'ani kɔdi obi akyi sɛ obi si sei nti sei na mɛyɛ me ba ɛneɛ na sɛbi woa na woyɛ etu amena ama wo ho ɛsiane sɛ obiara ade bi ayɛ n'ade pa ɔho nti wo ba sɛ wohu sɛ nneɛma baako mmienu bi ɛnkɔ yi a you're lucky, especially so the services are here, right? And the good thing is in pain be some of these friends interventions need help now insurance. Most of us are man. Se papa na nasma na kra unya makra. Insurance cover a lot of these services. All you need to do is be to an amount. And no na yet yen African parents na aye ye den no because your priority your adwuma. Your priority your double. Your priority you say weddings ni sabi a year ni niema bi eba ye be ye adwuma to tontade akese na ya hye. Na mom ni yem prioritize yem kra anase yem ma, which makes me sad when I see such things happening because akra no otini ba bi o e na wo kofa ne bai nti akra no your responsibility kase pa say de kroma say no o do back fa kwan bi so no amfa na amfa kwan pa so a bind me how no said the neglect need DCF for no money namely sad in no. So I was say ye proactive. Proactive means I will say ye my na yen tintia so who be say if you see something, say something. If you see something now suspect bia, please don't wait. When you're down for now in kususu. Sabi so mental health and our social worker be na unim na. It's okay to approach them first and they can help redirect you.
Okay.
What you say? Only be one who nim dear it didn't command and back on redirect you. Instead, say, what back yet and commodie baby. Because for all you know, the same person I didn't could this uncle or never sanko ton okra, ama okra wa feel it stigmatized, ama own feel it okay, because they will be some canon. Say, hey, send the pass missing the banner, yeah, yareful and ordination them. Which is a big stain. Obi no me kasa de we na e be ne de. Inti mpo se ye kasa akra bi ye yarefo no. Ye njai sa words ni yusu. Inti na brofun bibia na they have words they use. A kid with special needs. What you say? Inti say ye be ka yaref. That word is so negative. Until I'll say at a point when you have even the slightest your friend is say we say oba and I will be no. That is when you have to take away. And the other thing is sabi onyem no so ye nua baba is din kanka onyem no so uyo bi a now lifestyle no wa unim say niam bi wo ho ma wo ye na ni say wo ye and na wo ye ya or say obo date now o this anyama ne to on o doctor wha you can be very open and talk about some of these things. Say some more be or honma ubetimi enya because see a ma any sign na lifestyle be uli dia immediate or however. So ye no from even environmental factors. Oh yin say ye long according to ye nia babanis kamun sem bebre me ye be man intimi nchiremu pi ba kakra me ho no bibia timi si uwa adwumam kura bibi timi pemo wa bra wanyi sen no eme no timi kofa niema bebre ba so some of these histories you have to note it now hospital one my doctor ya where inti during Accra assessment and they can take note of some of these things send be ya say mo bi o hon say they can say earlier when ya instance you be train na niema akechi inti at any point when you have any suspicion, and that's if there is a genetic and that's any environmental way be what go through, please reach out.
That's it. Bra Frederick, mommy obi questions na bi so ba me phone. So obi say blood type bi wo ho no ma any blood type bi hia awo mu no etimi ma akwala na ye autistic ana say e dem pato betimi amaye mu ncheche kakra.
Me oh okay. Nia mekan say eno no enye no kre sa wo mu say mo blood type betimi lead to enoma be but not autism. Nia me tete ni me die edru no sa na e kire say bibisa ni ho internet enye no kre sa say mo blood type nitimi affected but since you know frank can most of the things can be environmental, genetic and environmental. Now you can environment start free your phone akwala ni damu nti no during insen no enuma bi o wa bitimi ama the problem aba ese wutimi atwe ho efiri ho na eba se wo pemwa no emwa bebre wo ho ese wo na wutu anamo unima bisa unima bisa ese anse a bit more omni health insurance, said the omo will be omni health, or they don't even care about it. Some of them even pay out of pocket. You say the year to quite idea. Yeah, Juma, scan crowns, yeah. And so, who are Juma now, insurance. And say, be a wunya Juma Pokrana, Colano, or health insurance. A covers our services. So almost start intervention. Sometimes up to even 20 hours, depending on the need. And I know you can gift you can say medical necessity. See a diagnose soon. Now, doctor I recommend this based on diagnosis near aqualano deficits, no, or better require this number of hours a week for applied behavior analysis services and as any other service be aqualani be here. Insurance, you approve insurance, and they have no choice than to pay.
Okay.
Here answer on insurance now approve it's up to the provider no so no or be provide information a chere say akwala ni gusu hia sa service no they could do that point na your omo adwuma.
Okay.
Now we adwuma me bia na every 6 months bia no on be reauthorization on be assessment on be observation on ma provide data chere say okay ye gusu ni ye na yeah, then start here, not 10 words, no team use, but Zian or use 50 words. You know, we provide this information in no what's actually areas are who are calling be here more. Now, and also no one make recommendation or the choir insurance and do 1 week, no more approve. No, I say I start. Into maybe a Monday to Friday, no, pretty much say, oh, our special needs are you don't really have a life because if you ever call a regular school about if the whole ban say or receive behavior analysis services are maybe from 3 to 7 p.m. will be a friend behavior technician and as a behavior therapist on on communication, social skills, behavior management, and you be brave. In some money now, say you get all those services now with time. No be say improvement here then. But send your question be can buy and resolve by itself.
Okay.
And so we be. Now with our intervention with akwalani so no na enyoman ye but say we it will not resolve by itself but you need intervention.
We need intervention.
About
Ebusu for
Professor,
say see na we do fidie no
Mr.
eto an we say ya. Me ba
Mr.
Oba TV. Okay, Frank, but hold on, mommy. And now when you go see a wushi, Bebrania can't intimpato, over to me a playback. Say, question be also not say, or feel say be a young kind, now over to me, dear, by any me a crowd on be answer. Come. Frank, we patok as a mammy.
But on my share experience way, I've worked with an ABA clinician before, and you see, say sometimes when you go to homes to give services, it's just like a crown, no problem. And then I say, "Ya damn for a okay. What about the idea you and your about 5 and you okay?" Now the parent will be in the kitchen or in the bedroom doing their own thing. That is not okay. It's never okay because say at the end of all year, how would you be able to repeat for a crown? You live with the kid 24 hours and as more hours. The person comes to your house for 2 hours, 3 hours, and you expect them to kind of do the magic alone. And you're okay. So say oba until you don't have a life. I mean, you need to be invested. That's how I'll put it. You need to invest your time. So if you want to get the best for your kid, say oba, you be there. Simple no be there and be watching at the crowd more. Then in there on any now also I day. Only wa only no etimi I day. Aye. Name me koba say oba na enye somji wa de na me nkoye ma de dia.
Say be so almost can't I to feel say be a whole makola no privacy na teacher no and I said you all buano no abuan because those are collecting so no ma me no ho no ma esu ni behavior and I will free one so esu ni behavior nti ano no
and then no, you can talk to the clinician directly. Oh, is it okay if I stay here?
Okay.
And I will be up a privacy. And they will be very open with you when they need you and when they don't need you. Because I have a client, a parent, or what name mommy is on the spectrum. And what happens is, no say therapist neba akrano doesn't want to engage. And earlier, you're talking about that social isolation. It is a crampo strangers. They don't want to. Some of them say they will home before they don't want to have any interaction with them because they don't know them. How do you give this kid services? But what I found out is the parents, the therapist in the back, something then they go do their own thing. How about all presence in there will make the kid more comfortable and more opening to feel say, me papa wa ha, me mama wa ha say, so this stranger crowd, I'm safe, right? Because that's the language some of these kids also speak. They need that security around them. Into debia, almost say, almost strangers are they'll push away and go back to a more comfort way, which may be their parents or their room and that. So I just wanted to chip that in because it's not say what they are crying service in tea. Some general, na me mean kobo hours and I mean kotadi. No.
Okay.
You are part.
Very important in your no eka no. Na ye tia ne say insurance ni approve hours na we insurance no at least 1 hour a week supervising clinician no and a BCBA no be parent training. Into obey training on interventions now behavior technician run and to say ni hwa as I say to step in now we are surgeon we use our skills and getting na wasuano during therapy sessions and I say during parent training. It's a therapist in the back in see I say twice because the goal just near Tiani said the therapist is not there to stay for the life of the child. Or be boa amakwala no I improve. Na de ba go say what you say nkwala no omu age out of services. Into insurance funded or base services no by 21 no are age out. Into adult service. Adult services no unya sa ayini biom. Yeah, fat therapists in both so on be run discrete trials and now on be chire o ade biom. Into say depend on the need of akwala na bi mu we ase wo group homes. Hono staff do the bare minimum. Nti nya sa amre no mbe kire bibia biom. Nti from early intervention throughout to say mbe high school na mbe age out no. Sa amre na ye critical, very critical in the lives of inkwala or more special needs and especially or more autism or more receive services. Nti sa amre na hu hia. Nti na say amre bia no say me ba fie na me provide supervision. The technician shouldn't be alone with the child. There must be an adult. Ofio ordinary ADHD every say na eko na every week no supervising clinician no at training I be a friend parent training about senior obe handle no be na akwala no behaviors be nti na okay akwala na struggle with behavioral incident and as behavioral no struggle as say na say we ye wo enoma bebre during intervention say be this reinforcement procedures, schedules of reinforcement, punishment. Now, make up punishment, now use it cautiously. Punishment doesn't mean abuse.
Okay.
Yeah, but near the Titia Mun say, Bibi Abeya, Emma Palani, and the Suban Bia would dare Nadine, Ebiumuno. And I say, Bibi Abeya, a better even I use the word deterrent, and I know I didn't crack. But basically, no, I mean, my example say, Abia. Me withhold the privilege an example of punishment. Me family sanka me born, but essence one your ABC use iPhone and our tablet until say be aware adequate. And now say you prefer see be use reinforcement mumpa. And what time book way I phone way at to her na mama pen. And the more now, yes, and I me sharing crying and I say me reinforce desirable behavior, no, a massa behavior, no, a tokos we so it has and this annual man getting near and a crewman. You can even apply some of these principles on neurotypical kids. In the crewman, you're monquala. In the annual man way, no man getting it as a usia. It will be to me using effectively to your advantage without raising your voice or even spanking a child. And during intervention, you were specific in your I develop skills. Say discrete trial training. Social skills more social skills groups are more running. Be specific to the needs of Sakwalaro because during assessment, one who say area way na area way one who deficits. Into no be come up with interventions that would target those specific needs, to develop them. And then say communication, then you are targeting communication. A behavior, you are targeting behavior. And you can't behavior now. Me did say be a mean you about be that. And I say one who be it can be heartbreaking to see a child struggling like that. And on top of that, now stressor, of course, caregiver and our parent now, it can be very overwhelming. Internet who here say who seek help in them. Now what the new because again, you're very big, as I didn't know to because your use like shaping, what do you call it? Task analysis, just anyway, how we about work why used to certain routines and procedures over time. Internet say what because when we are regimented, and so all the new 2 years, maybe also on call or that's one thing about quality be more spectrum because when we are very regimented, whatever they are exposed to over time, and not become part of their routine. Into how normal behave.
Right. Mr. Bennis, why you bad tiny dear? Obi a boost a question be say parents and so what could you can ask and colano emboa omo and a more can was him. But parents no more and colasa almost what training be a omutime qua ebi and also to me boo omo share omumba e was or how ni muana. Obi a
Yes,
question, sir.
yes. Mekasa number one training here from home. Say ABA therapist no eba. Mr. Mode ABA therapist no ni nyinaa no. A very great opportunity say wo parents no so share those techniques no. And not just a work with school nko a share those techniques no. Na wa model and I say na wa only akwala no a practice. Because 2 hours and now 1 hour ABA therapist no any akwala no share like during the week no alone doesn't help. Sɛ ɔkɔ a nso deɛ ɔbɛyɛ atoa so no ɛno nso boa paa. We also have in-home therapy. No. Social workers can also come in, mental health clinicians can also come in. Usually in-home therapy is 4 hours every week. 2 hours 2 hours like for 2 days. 4 hours near 2 hours. One of the 2 hours no say in-home therapist ne any akwala no therapy. The other one no family. Say wo parent no also bɛka therapy session no. Ɛwɔ sɛ ɔka ho na wobusa questions. Now also wonya nteaseɛ ɛwɔ the akwala ne behavior and because most of times parents any akwala ne mpo ɛnte the ɛrekɔ so no ɛnte aseɛ. This is an opportunity a parents ne de betumi ɛde ebusa questions. Na wahwɛ akwala ne behavior na wanya explanation. Afei nso yɛwɔ group support. UMass for our group support Emma parent and I say families are more family member with autism. Your different group support and UMass in I know say autism association for so our group support and so no more parents ebetimi use so ebano resources yɛmfa ne sɛ financial resources. I don't want to go so much into it, but there's financial resources for the parent because I will buy our symptoms and I said disorder initially. So about disorder ni be especially very very severe disorder no parents na sometimes I na yɛ den krampo so obekɔ adwuma. There's housing for the parent. There's financial resources for the parents. There's food assistance for the parents. Unso benya emra wo hwe akwala no uhu hiahia bebre wo ho nchiru bebre. I know say it's not enough as compared to be a wo kwa wo ba, but at least bibi kakra enso ewo homa parents no. I know so sometimes no we don't want our kids to get the services because say me one time me di and I say me then me nye sika kakra to me ho me then na me tria me rent and I say me then na me yeah there's also utility assistance for parents as well. It's Mr. Mobile services and I wanted to mention something but I think some refi I wanted to mention a major resource yeah available. Yes, there's also respite resources ebia opese especially for parents or money what very very severe symptoms ebia opese wa momo yare opese okwa appointment biba se bi ontimi ni akwala na enko e wasa akwala no obi hwa akwala no ema for some few hours ebi wo krampa for some few days because se bi otimi yare koda hospital one e be hwa akwala na mame there's respite resources and so ma akwala no. Yes, the family also have resources available. Ni nyinaa ne sɛ wobɛma wobɛstart free akwala ne pediatrician refer wo to all the agencies ɛboa ABA therapist ba mu a refer wo to social workers ebetumi aboa ama nkwala no ɔmo ne family ne akwala ne nso ayɛ adwuma.
Wow. Na sɛ mmoa deɛ bi wɔ hɔ ne nya ne sɛ wobɛhwehwɛ brɛ mesra mo monhwɛ Isabelis the medicine said do na anim no bra Frederick deɛ a lot of reserve nti no watu nya cheese Isabelis nko ɔbɛkyerɛ baabi abra Frederick hɔ no akɔ akɔhu no momma yɛn utilize yɛn nkurɔfoɔ because ɔmo na yɛtimi yɛbɛtumi ne ɔmo aka yɛn nsɛm ne yie na ɔmo ate yɛ haw no ase yie na ɔmo nso atumi akyerɛ yɛn baabi a mmoa no wɔ na yɛtumi akɔgye mmoa no menye ti so obi a bra Frederick ekwa wote so ega na nyia odi mika baba bi ye ne saade a ene de bia ho be kire because say de enua ga na fo no omani abre pa person mo boy nti ene be bia be ko bia wo be hie bi wo hono mo ye sere mo a mo ma utilize enua no mo a omotu omo ho esi wo so mo pese omo boy yi bra Frederick but what are the risk factors meaning see I can want some more for autism spectrum disorder.
I think so. Yeah, can't be throughout the discussion. Na ebi ne say omutimi develop other disorders and also comorbid disorders. Ebi kura ne I don't know how to explain this, but you'll be as a friend fragile X syndrome. I don't know. I don't see a genetic order. Most of the time, in Kuala ya no more autism, no more. Meet me that nya sa we saying, and only a gene change. And a cause sa a gene change, called the X messenger, no, and affected. As I said, brain to me produce protein, right, to help with functioning. But then because of into the brain into me produce protein into na no na just no more function send there's more function. Me try pass it me but yeah. I don't know one of the thing because I don't know the brain development. So, but then when team produces protein into inhibit brain development, and can be nyama function to say those are some of the risk factors. I think say can be say say we are old, and I say you are an older parent most likely say a bit me resort in so be work or a friend saying autism so
me pacho was okay old and now can old say bia won fie na dru be yesen a
wo fie no kwana nim a me kai say minimum bia na at the time of conception na things no 35 but na doctor no was so concerned say o mani test saa ko see say eduru ba bi kura ampo no na ehu aba mu kakra ma na parent ni hu sɛ ne yɛbɛkɔ akɔ wie na wɔ contemplate kura za ne te kura de ne mame sɛbi o me anko abɔto akwala no enti no ɛno no obi timi at 50 obi timi awo akwala a ɔyɛ normal but then the risk factor no high the risk of having a akwala or what do you call it autism no high to say even Down syndrome maybe area say the older now parent and most likely so be me into from 35 upwards no it me common among that's not to say younger people don't minimum be a teenager so akwala no autism and no but in terms of risk no say mfie ni konanim kakra na and also ewo
okay Benny sasa na meko minyame ma franco ni yemfa mbra yenya ye fie mu ekwan ye fa so a ye treati enkola a omo sa yare bi no me pese uma ye nchirechire mu kakra ha wa ekwan ye fa so ye treati omo no ebetimi nso asan affect omo mo because minim be on ma bi ase na okay akola no delay speech so it mean kasa ti ade ade ma na bi o say one come in from ma kana unka ko how negative does it affect akola?
Yo, that's it. I know, say Africans, yeah, very strict, right? Well, how you training, yeah, ma. It has an advantage, but then. Ubon so to kwaya so we African ni bia na so ye Ghana ni a ubon so ja start school pe no why timid, right? Because of how you training ye de hu bi hye ye mu. Enti sebio wo krampa wo feel say na woni condition ni bi krampo no. Wo de hwese na otu kwan Bible cha hwese na wo ye. Ubon say no why different. Enti no ye fan compare obi a owo condition no, owo autism no. Wo yes ubu na bam. Oni that motivation or they ebe kasa or the ehu it's almost so no ana one thing I think say minim say kan most of the enkwala ewo disorder no omumpe dede ubon say blender crampo ye noise crampa they hate it it is uye dede like ucheche mu go ne so shout at them no like ubon say no we sin and no adwane. And that can also cause that SIB. No one say ni bufusa no diniti about dynamo na otete ne skin. Now yi ni nua wo ne ho na obetimi edem obetimi wardrobe obetimi aka closet mu eyi niam nyina pie so na bra Frederick kan behaviors ni bi wa ya na ehu pa ehu serious eti Mr. Mo say yentiatia enkwala no yebenya entoboase amomo meka sɛ uhu sɛ oba ente kasa even crampo no oni akwala ne doctor ekasa ade ba kombema akoye ye eyi hearing test ebi crampo na akwala no ye wo no hearing test no opase ye but along the line no bibi timi si ye ema kasa no o afede o kasa onte enso no wunni ma be oh maybe the when autism no Mr. Mo ye ne pediatrician na enkasa first na ye ne akwala na ye mben do you understand what I'm saying ebi wa ha ho sa akwala no enye obia na kasa no oti obetim enye akwala bia na se onyi a kasa like sentences complex sentences obetimi ate ase ye be make sure say ye be breaking it down aba akwala no a level another thing na a man akwala no so lose motivation to speak I know say we are focusing on autism. Remember, say akwala no yenene ka chi and I say uka different language, grandpa Ghanaian language or primary language wo say bi oni ukunu and I say one abusheni bi kan wo fie or phone calls. You have a primary language. Akwala no ye America ye ka brofo ewo honomo. It is a nneɛma we nya ya na etimi confuse nkwala no. or start speech therapist be catch us or the koswa ka primary language no na ono nso brofo no nso no the on kan yeden a obey den. I know some most of times I na ye bohu. Oh my god, maybe no ntimi nkasa why you confused. That factor is there because of two languages na dual language na ewo honom no, and most of the time so say yeah any Africans nko. I know I've worked with a Grecian family it's on some Greece into no any brofo into no and ma kwala ni speech e delay enti ebenya ntobo ase do na kwala ne ti ase and American most speech therapists will tell you say go with your primary language brofo no obete yɛne ne bɛkasa yɛbɛyɛ action ɔrekasa oh go take this for me anaasɛ ɔbɛhyɛw no oh ɔmma no aduane ebi a wobɛbusa no I know say yɛ African parent most of the time yɛmpɛ choices right fufu fufu na ɛnɛ yɛayɛ no a na yɛbɛdi what do you want you show them the fufu you show them the rice do you want fufu or you want rice anaa wopɛ fufu o wopɛ ɛmo it's uchi akwala ni say we ye rice, right? We see ye fufu. Choose. Uba sa akwala na be choose the ope. Ni nyina ye ntobo ase. Me shira matiati and I know say sometimes na ya na ye pentem. Aye niema bebre. I know how stressful it can be. But me shira mo ye nya ntobo ase. Ema nkwala na ye down to their level. One thing that we also want to do is to read with the kids, please. Sebio Akolana, the reading should start when you are pregnant with a kid. Say, oh, onye makolana, read it tre akolana, or say your phone or te, dear cosono. Unia, o de ne kwa point, mabon send on the doctor money book, Miss Rama, my aunt train. Ya ba, yen cha akolana, and say, ya ha, money and then go over. Picture. Unim reading Mr. Wo. Ubon sa akwala na estarte 1 year. Books a yede ma ne krampa ya na ntwerɛ bi anim. Ubon sa ntwerɛ bi ani. Setwi aigbe nkran Hausa kasa bi a wo kasa no. Oh, one yellow tree. And a yellow ye brof. One edua. Edua. Oh, edua mase. Edua timi boa ya ma ye home. Na ne akwala na kasa o. Na wo flip it. Now one kasa as parents no. You are creating stories around the pictures na. O de cha akwala no. O nene che. Oh my god, baby. How does baby crying? Yeah. Na ne akwala no. Nkwala no mesha mo see creative play areas ne ma nkwala ni wo fie a yentena form like we should sit down on the floor and play with them. Oh, this is the fire truck. Ooh, this is the ambulance. Not air noise. Ebia animal sounds. Say a talk teddy bear nema and mofrana. Let's create stories around teddy bear. And I say stuffed animals no. Oh bird, frog. This is how the frog cries. Nina na obua akwala no ema ne language no. Nina so all building a social interaction. Another thing, some obapa ukasi ujaya and some I be kandi.
Ewunya, because you double bono. And then am I to me no double no. Everybody a break.
Another thing is to say, yane nkwala no MPA, some bay, yanko park. Yeah, so you observe nkwala no sɛ na ɔmo ne nkwala foforɔ edi agorɔ. Ɛboa with this social interaction. You know, na yes, sɛ families were around I know say yɛyɛ akwantufo obi wɔ ha oni family ɛwɔ ha. Menka sɛ kɔfa adamfo twintwan. Obroni bɛfrɛ bibi play date. Oh Frank, ɛna ɔhema wɔ fie. Oh, mede ɔhema ɛba. Ama ye ɔmo di agorɔ kakra. Na sɛ wo ne akwala ne nko ara hyɛ dɛm ɛkyɛ 2 years. I know so I wouldn't blame a lot of parents, especially this COVID era. COVID I know say aba from kakra, but COVID by you know. I don't blame parents. I was so the akwala ne hyɛ fie until the mesrɛ wo wa panin kra wa hyɛ fie 1 week kra isn't it? Yeah. na akwala de na hyefia hu bia na oko se bi obepie no nkofo obehu am strangers enya da se na America no I know so some people don't want to take friends but obi kakra unim no de oni akwala no mpie play date oni akwala no any akwala foforo enhia yeah no obi wo ho so akoka ne ba asem so se bi na ne buofu akwala ne bo obi a you don't hate other kids when you are playing. You play with them. You put your hands by yourself. You know, na ocha kwalano, otnitin or dokwan. Yes, I cry and moi cry. Na nina he misro my yes yeah just
Yeah,
recommendations.
but Madonna, the question was your journey late.
Yeah,
The question is Samano.
Yeah, and come me chip in really quick. Me person me make yeah, me person me make correction be quick. Autism and yet developmental disability. I mean intellectual disability. And autism and your mental health what do you call it disorder and your mental health disorder. Me person me correct it and no tinebia na inuano otie no say your mental health counselors, licensed mental health counselors, or I just want to explain that. Say it doesn't necessarily mean say autism a mental health disorder but they have knowledge and experience, massive experience working with these individuals. Now in our community you need a lot of clinicians are almost and I just want to make sure that I don't clear. However, they have a role to play, and I believe Seminia Frank, Minia Frank answers our question because only Ben is home area, I don't know, mental health. And now me call back to nearby kind during intervention, and as animal cost and you what kind during intervention, technician no near during that time is animal walking a cost. And again, your special terms and a year you used to say be a natural environment teaching. Oh, and as incidental teaching. During some running, and to say be a 1 year parani diagro. What is this? Oh no, I can't say be it's a train. What sound does the train make? You know, and your master now question and answer. Now all train be no. Aha. And during interventions, animal in our course, you know, all canny and cray. Say we saw master uncle and exposure no. And go down to their level na unomu diagro na unomu esua sa anoma ni na just say more my because bibia sometimes they got social anxiety, you know, so ko nipa mu a na feel timid bisa nti sa anoma ni na boa am build confidence. Now going back to say na all can say yet nkwala no ne ade na ma omusuru ana say timid sure all can say pepepe enti no say akwala no unim say ope nsuo ne me ye ne say akwala no di nsuo ne brami a I mean nim say o se mbie so man ba me pese obeka ansa because wo pese osua say o ka onya de bode no nti on the bar me hwe no wan ka hwe a me prompt response no either say me can say may you should be a one word pe help or can help no ma bia man bia me per se make more sense bia me can say open so no be obeti say open just say bie nti say o can say open no ma bie na me dem dia ma no nti no me o yes to aso a e be duru ba bi me require say obey you say bia a phrase not even just a word nti na bia next time me can say bia open please. Do ka open please na no onye ka open ka mimbie ma no enu nyina ya abotre do ka open please na ma bia den aman going forward no e bia oba meka say Frank, can you open this for me please? Then is what quadrant you want to say wa master and you many nyina ma do stage bia for bit ma form a whole sentence samre no mu na answer no be man to start with one word when ya a phrase when ya a full sentence when you know say our masters are skill do here bibia afede e free bibi generalization ebia Frank pɛ ɛna ɔne ne yɛ saa de no but yɛ pɛ sɛ wo ɔba patio otimi ko hyia wo ba bia ne so ohia mo a otimi ba wo nkyɛn na ɔka sɛ bie ma no saa na sɛ yɛtimi hu sɛ ɔkɔ ohu bɛn sa obetimi but Frank pɛ ɛna otimi yɛ saa ɛne na on generalize saa skill no and the goal ne say bibia wo kyɛ no bia ɔbɛ generalizing across persons, across situations and across settings.
Wow. Ehon de na hu ya me pa because no sin na ye pese nkola ni so yes me mu awofo no kire se o pese akola ni hu no entiantia no eya na adoso ene emi se ya ka bia questions ne so no ya answer bi me pa to so question bi na pese obusa ye wo be 10 minutes pe aka enne si no mo bi mre ne ye tight so menya bre amayen abemayen chire no ebedo ma se papa inti ma start we sister Benis so na advice owo ema yenua no mo a omo enkola omo hia mboa sa no odi ama omo no sister Benis pacho obetimi dia me
Yo, before say mema advice, I think so bibusa questions. So what does mental health counselors got to do with autism? My name so or started joining
so join me late.
Oh, okay. Send a kind autism no so akwala bi or autism sometimes it comes with other condition. Ebia autism no the fact say on so nipa no wo ho you look different or you behave different from other kids. It can cause depression, right? Nti no yeah ba boa saa nipa no ade kode a air cause depression. Ɛno na yɛne nipa no ɛba bɛyɛ den ɛbɛboa nipa na ma saa depression depression related to that autism no yɛbɛboa nipa no ama ayɛ den manage that depression no ebi nso wɔ hɔ nso a ne deɛ no yɛ social like social anxiety. I have worked with nkwalaa a ɛwɔ sɛ physically no yɛkyi ɔmo firi awofoɔ no ne yɛne ɔmo kɔ walk kɛkɛ yɛbɛboa akwadaa no autism na has symptoms, right? It is that symptoms yɛbɛ breaking it down. So mental health counselor no ɔno nso ne role wɔ saa symptom no ɛno na yɛba bɛboa akwadaa no anaasɛ saa nipa no amanage saa symptom na ɛwɔ hɔ no ABA foɔ nso wɔ symptom a ɔmo use so ɔmo wɔ more rules a ɔmo use so in their approach. It's almost ɔmo deɛ no ɔmo wɔ mu a ɔmo nso no they are taking care of. Yes, yɛ wɔ mu ana yɛn more yɛn frɛ yɛ clinicians, right? Yɛsan wɔ in social work anaasɛ mental health yɛsan wɔ bachelor's level nso deɛ wɔ hɔ. Yɛwɔ therapeutic mentor. I have done therapeutic mentor before. I remember taking kids to the gym. Onene ko gym, onene interact. In fact, my meeting at that time. It's an also role so ho. It will say services no dear ɛwɔ hɔ bebree gu mu aroro obiara ne ne role. Yɛwɔ speech therapist, yɛwɔ early intervention for nso wɔ hɔ a ɔmo nso ɛyɛ ɔmo deɛ. It's no ɛyɛ mu nkyikyɛmu. I hate to say, let me to break it down to make it simple for everyone. I hate to say bi obi wɔ diabetes. Who primary care. So primary care never refer to a diabetes specialist. They be a obekwa kuhuno. Say diabetes specialist was saying ebia high blood pressure be asamba omo be check wakuma ni asan refer you to another specialist. Sana akoye. It's you're breaking it down obia woni role or play ɛboa akwalaa no ebi wɔ hɔ nso koraa mpa ohia medication management wɔ baby nti ɔno nso yɛde no bɛkɔ akɔma psychiatrist ɔbɛboa with medication management ɛwɔ sɛ akwalaa no pediatrician nso wɔ hɔ nom a ɔno nso hwɛ akwalaa no ebi a n'aso biribi wɔ n'asom ɛwɔ sɛ yɛ take care of ne nyinaa eti no ɛhɔ na mental health counselors no ɛba ebam yɛnso yɛboa ABA therapist nso ɛboa obi abwa it's no misremo if to America say there's so much resources ɛwɔ hɔ no ɛwɔ hɔ bebree kwa mesrɛ wo menhyɛ dɛm memfa akwalaa ne nhyɛ dɛm mesrɛ Ghanaians mesrɛ Africans mesrɛ mo bebree wohu sɛ obi ba ɛwɔ autism a let us not discriminate mesrɛ mo and my end discriminate. Let's stop the stigmatization. Ni be ya yare for sebi akwala Jimmy me dem ne me and me be ni agro. Let's stop that. Yemboa ye ho. Yemboa ye ho. Well, autism can be highly managed. We can manage autism. Emma nipa nimpo na mo krampa hu se yanka ankyerɛ wa nya ne maame mi po na bebie na no aka kyerɛ wa uhunu mesrɛ mo bebree yɛn nyinaa as a community we have to come together to help because make play date yi wohu sɛ obi ba ɛwɔ obi na ɔka se ba na me bɛyi na ɔne ɔbɛyi mbɛdi agorɔ wɔho sɛ wo nso woamboa parent na ɛnyɛ yie yɛn nyinaa yɛmbra together na yɛmboa yɛn ho as Africans as Ghanaians as people as human beings let's come together and help each other. Thank you.
Oh, Mama was secret gume. And if I'm coming, you have a Frederick on Mona, on also my and the last words. Nah, and then, in fact, topic I think there was a century game. It's very insightful.
That's it. Say, kwenya way. Na say the okana, ebe pese da chibiano. Say, based on demand for another show like this, we open to it. And nyame kan say senior sister kind autism no say akwala will be and our akwala no so will be it's not the end of the world. So who say a manageable and a treatable, which means a obetimi manager could do stage be akwala no be function just like obi problem be no obetimi akọ school obesua de ahu enti no ohia support na support ni start free bra wangaza no o se ne enua frank kan say o suspicion bi say enyo man sisi se ne esese sisi no a watu hu na mo ntem enye ferie asem eye wo ba daachi endwen ne nipa beka ana nipa besusu afiri enye bone a wo waye ana bibia waye enti ana so fuma wafuma obi nti ena ma oba no enya sa disorder no na mum esi just say okay prevalence rate na very high I don't remember the exact figure but say we nkwala be say close to maybe 50 anya kwa obenya akwala ba kwa or autism
one out of 39
yeah 1 out of 39 40 50 kwa de makwachi so the prevalence rate is very high and sometimes I say who say enya contagious nso and sunny enti na his sister can and sunny enti no say wo ma ho kwan a emma oba wo ye neurotypical kid our skills now onum be boa sa akwala no na sa akwala no kura no be dan model ama akwala na wo autism no because nkwala sua de yi efiri wo mo nchen nse ni wo se ni tipen ya ade bi a otimi sua ne ntamfiri ne nchen esen se wo panyin no beka a kire ne se yesin ana ase yesin wo sua ade true experience nti a exposure na wo man ho kwan na wo interact with other kids say play data ana say man kwan man nye free emfani nsie na ontimi and realizing the full potential esen se wo no be sie na wani ba wo se na kwala na nyi na fe or better than a social misfit, like Okoba Bia and Kwa or odd. You don't want that. They're so exposing in terms to Ubia, and I can't say, which then begins with one. I saw to me generalizes adequate across. And so to me, I couldn't fear or be drew a certain as children's service no more as adequate. I saw to me, so when to me, and not on to me generalize a skill near. And now Koba say Frank no ne ya de sem di kan no to me ya de kama na fe I didn't know bedru how want me generalization hasn't taken place yet Nti na say wo tokoso. Nti sa ne hia say ne wo kire na no need di agro wo toy room a no need di agro no. Eye. But then Fanico library, Fanico children's session, both in Kwalai, Diagro, they play with toys and books. Now or no more interactive. Different environment. No one say, I do cry Hankwani, you know. Because they are so regimented, say, near watch and not being a capture and say, sa setting in an environment, no as I didn't take place. But woman exposure to 2 or 3 environment with similar things happening now. Now one who say, okay, where the senior, you know. Nti no ehu behia ye kasa ye kasa ye nwie se na ye nua bandi kan kan ye wo nneoma bebre hyew ye ntimi nyini nyina mpie ne
Sa. Yeah, that's a brain your Bema, Frederick. Frank, you have Bema.
Me nua bam dase. Answer. Yeah. Me nua bema Frederick ni me sister Bernice. Aka ni nyina. Me pese for the sake of our time, me touch on who we are and what we do. Ebia obi entiase. Ye nyina ye group of friends saying Ghanaians, yeah, pese a term to another extent, like African behavior health workers. Ye can ho abom. Sisi your membership of Nipa 10. Nti enye nyina ye ni o. Ye nyina ni enam time while in kroma say time nti ye mu bi e wa adwuma mu. Nti no man ntimi an join ye no. Nti ye be represent omo. Nti se uhu ya ye dose pa. Nti ye wo obia so ne specialty. Even ye wo omo ko school this field is what they want to work in. They want to become social workers and as a mental health workers and as a obey ABA technician and a bibisa. So obi tie no ni mobia busan bakone say what and kana because your person you have everybody on board. Na si ye nyini na ye team you person be having a big kind of occasion where we will act at resources for you. You just come and access anything out here. Then we can redirect you and channel your problem, give you resources and where to go and get access. Because in fact, this field is a calling. Say, oh yes, sir, oh this kind of here, maybe I had your own, but it's a calling. Also, what man say you want to be here, you want to be supported because time I you may know ya bre or one can say but because you say young Africans and I say Ghana for no mental health is not something that you need p man be brain ya spiritual and in pie bon and so yeah say so your bomb pie so we prefer say we have everybody on board. We prefer say we open ourselves up for people to ask us a lot of questions so that we can direct them and also redirect them to the right person and as a right place, they will get the resources that they need. So we are just a group of Ghanaian mental health workers, not mental health, like mental behavior health
Behavioral
workers.
health.
Yes, we're here to assist the community and provide the help that needed. And we will be looking forward to another opportunity. It's not only autism spectrum disorder. Like the last time we touched base only on depression and other related diagnoses, right? There are other big ones. Maybe in future, personally, I want us to open up and talk about trauma. Maybe not now, but at a good time, because that's another big thing that we kind of sweep under the carpet. We don't want to open it because it's big, but a lot of places. So we thank you for the occasion and thanks for having us.
Your Bema PK on the Miami your Bema PK. Also, please, when will there be, I guess, be English version of the program? So those of us who don't understand the African language will also benefit. PK, I promise you, say, we will have an English version of this program. Even if it's not this program, other programs, but it be about late until almost starting. We can say, because some times the crowd, they do a chroma crowd, chino, to me, and give you papa. My brother, so a dorsal. Now, so send a bay, you know me, a bet see, I see, ya my yano. Now, if you say no, soon ya pa, into not chino dorsal, into no, ya bay a bro for dear, don't worry, I promise you, PK, so don't even ya ba. I promise you, I bay a bro for dear. What's it? And I sister myself, that's why you say, please, can you organize talk to the various churches? It will greatly benefit all. All right, we will work on that. Nina, send on Kaya, no, Omugusu Buabu, Omudoso pan, Omobu, no, Ebegusu, I pin chain, Omo, send a beya, and Yama, Winya, Efa Apomudin, Winano, Omudebe Brain, not be giving him baby and some, yet to me, Aqua Cote and Bois. Minya ba Benis, me having your Bema Frederick, and a Frankie dear, Minana Shubo Winter. Yet Damunia si bebre, send Nemutimi ba or Papa to your TV so a betchere and Yama be brave for autism home. Medimedi say ye pin them will be ma, Mumbumuti, over Samba, Namoni yen about betching como. Yet I must see bebre, Yami in Shram, it will be a movie. Yeah, we see for ya better must say some join me yen na mo de mo comment and mo insem bi se bebre e ba ye mo comment no aboa papa enti ye da mo ase mo comment ne de we ne aboa me no because senior me questions no ama bebre questions no kwa na me bebusa no eno na enne mo de ba ye no enti me da mo ase bebre ansa na me kɔ no me pacho me wo announcement kesi am pese me ye nemo na me ka wo so say tap send say download app na mesro bebre so be try now what download tap send if it's a tap send there eye app bia ye de send sika ekɔ Ghana and one now de send sika ekɔ Ghana obuto oyim usika enko kem rate ne so e wo soro enti mesro bebre o pe bebi do sika afa na obuato oyim dia men tap send ho na de ni ka wo mu kese ne so say so we use promo code oba papa you send you $15 e ka usika wo de air ko ti me so bebre say won download tap sender bomodian na download say na be ya wonsa e be ka $15 good job account first ska wo be send ya ko me da se bebre sound so enna yeah you know more feedback there. In fact, much dene. If you say 3 weeks accelerated phlebotomy training, abahonomo, so person we phlebotomy star, Miss Row, ye was so nitty announcement we mammy. If you say we here pa training way ebeko to 3 weeks pet no when your certification now woko ye with Juma to Miss Row. Bomodia na hwehwe omochira kwan na koju training yi. Se na be ya also ubenya certificate now they ye ejuma. Omuye daytime, evening classes, and a weekend. Nina wukwa. Ometimi achirechiro. Me pato contact omu na so mechira kwan. Ewo 508-667-9334. 508-667-9334. Oso show mechira kwan. Ewo 76 Summer Street, suit 340. Eye 340. Ewo feedback me pacho unsa ebekon bomodian nako ti 3 weeks pe me pacho pemre emre ene ma utimi di ko wanim nako ji certification if you say so kita certification na eye wo dia uni obi an bom hye obi aso ntimi nsisiu ntimi sero hwehwo mo kira kwan nako ji certification nako yi wadwuma papa edwuma be ya oso bu beto oyim medam ase bebre say ne mo join name mo somfo oba papa tio ewo health awareness month yimu medam nyina ase yam nhira mo no nka mo health talk ni de bebre mo but program bebre so wo no a ye de bebre mo mo state team ewo oba papa tio ti so medam nyina ase